Hello everybody, my name is Jose Mongalo, Jose Luis Mongalo. I'm the director, one of the director of one-on-one training implant course. This one-on-one training implant course means an intensive training. The case for Dr. Tren was advanced because we were in a small space, and atrophic mandible also, and then in the lower incisor, the four lower incisors is the most difficult cases to place the implant in the perfect position because we don't have a space for places. If you do a half millimeter mistake, all the surgery is done. You can keep going. And this case, the Dr. Tren learned about flap design. That is the most important part. Flap design, anesthesia technique, soft tissue management, emergent profile of the implant, also biologic surface of the implant meter, the distribution of the implant, primary stabilization, and of the implant placement. That is the most important part. And he did it very well. And congratulations for that.
So the purpose of this trip, as a new dentist, we're always trying to improve and increase our clinical skills, specifically in difficult, intermediate, or advanced implant cases, so that I can help the patients that I serve in the area that I practice. The second case was pretty tough. We did 4 implants down here. First, we needed to take out all of his incisors. So from canine to canine, we left. We took out these teeth, and then we had to reflect the tissue back and level out the bone so that we can have a flat platform. And then basically we had a very limited space. For implants, we have to have a certain amount of space between implants and between teeth, or we can cause damage or cause the implants to fail. So what we did is we measured how much bone we had, and then just strategically put the implants in the places that they needed. And sometimes, especially after you have an extraction site, sometimes the drill wants to move in a direction that you don't want it to go. So you have to keep constant pressure in the direction that you need it to be. And then having all of those work out the way they need to, it's really tough. So also being in this front zone, we call this the aesthetic zone. So it's an area where people can see. So we want them to be perfect. So yeah, I just placed one implant here, and worked my way toward the midline. And we weren't sure that we were going to be able to place these two, so we based it off of these 2 implants here, and we were going to see how it went. And after those 2 were placed, we had the space, and yeah, it was a pretty advanced case. And but it was a great experience. Every time I do an implant or a surgery or a filling or anything like that, we're always improving. That's one thing that patients might not understand, is that dentistry, they call it the practice of dentistry because we're constantly improving, constantly trying to get better. And so this was one of those cases that I feel so much better being able to place an implant in the same extraction site. It's a pretty tough deal, so I feel pretty good about it.
In this case, your flap was perfect, and in the area that is very hard to leave the flap. and you feel it in your hand. That is the most important. The confidence and the skiller that you feel in the hands. Okay, and well, good job, Dr. Trent.
Yeah, and it was great just having you like side by side, helping me, you know, guiding my drill or just telling me just those little tips really helped a lot. So,
no, it's a pleasure.
Yeah.
It's a pleasure. We go is like you say. I really appreciate the help for the guide for me. That is we go.
Yeah.
And if you are happy, I'm happy.
I'm happy.
Very good.